The next speaker, we'll keep moving quite swiftly because we'd like to get to some Q&A at the end. The next speaker is Professor Alexandra Barratt. Alex is a professor of public health in the School of Public Health at the University of Sydney, and just a confession, I've followed her work for many years and always had great benefit from reading some of her papers and following her work. She's recognised internationally for her research to quantify the benefits and harms, including overdiagnosis, of cancer screening, particularly breast cancer screening. She's lead investigator on Wiser Healthcare, an NHMRC funded research collaboration to reduce overdiagnosis and overtreatment in healthcare, and has been trying to figure this out for many years. So welcome, Alex, over to you. You may be on mute, Alex.
I am on mute. Hello, everybody. Thank you, Jeffrey. That's a very lovely introduction. Can you just reassure me that you see the slides?
Yes, we can.
Okay, fantastic. Thank you. So I'm very glad that I'm actually speaking directly after Rochelle, because she's done a lot of the heavy lifting for me. So thank you for that. Like Lucy, I'm going to just turn off my video while I'm talking. But do you still see my slides?
Yes.
Okay, great, fantastic. So I'm not really going to talk very much about overdiagnosis, particularly as Rochelle has covered that so well. What I would like to say is that one of the things that's important to do is to consider how we get into these problems of overdiagnosis in the first place. So here's an example I'd like to start with. This is actually the situation, something that unfolded in South Korea, going back 2 decades, 3 decades now. And as you can see, what happened was that there was a massive increase in the detection of thyroid cancer. In fact, 15 times as many people became diagnosed with thyroid cancer and had treatment for thyroid cancer between 1993 and 2010. This has become the sort of poster child for overdiagnosis, because what you can see is that although the rate of diagnosis of thyroid cancer went through the roof, the mortality, which is those little green dots down the bottom there, didn't change at all. That's down here, these green dots. That didn't change at all. And so what was happening on investigation was not actually a disease epidemic, but an epidemic of diagnosis, which turned 15 times as many people into patients. They became patients unnecessarily. And you can imagine the extra demand on the health system, the amount of cost and waste that was generated, and how much harm that did to those people and their families. And they didn't need to be there. And as Nick Watts just said, the health system actually caused this problem. It didn't need to be this way. We didn't need to do that. And it didn't help, as Rochelle just beautifully explained, it didn't help patients to do it. They didn't die of thyroid cancer because they were never sick to start with. They were just overdiagnosed. But we know now, and our research has shown over the last 2 decades, that overdiagnosis and overtreatment is widespread in healthcare. There are many, many, many diseases, and Rochelle has mentioned some of them, or conditions that fall into the category of being overdiagnosed. But what I'd like to talk about is one of those drivers that Rochelle mentioned, and that is the testing. Because in order to get diagnosed, you have to get tested. And as I just briefly flashed up there on the screen, having all of those extra patients doesn't just harm people and cause costs and waste. It actually all contributes to the carbon footprint of healthcare as well. So with my colleagues, Scott McAllister, Forbes McGain, and Katie Bell, we decided to try to look into the carbon footprint of some of these tests that are generating this problem. And we did this study. It's a life cycle assessment. That's what Scott does. He's an environmental scientist. And what's really important to appreciate about this study is that it is done by a form of life cycle assessment, which is called process-based. So you may have seen, in fact, I'm sure you have all seen those estimates of the amount of carbon emissions in the healthcare system, the Australian healthcare system, that Forbes and Aranima Malik, Scott, and Manfred Lenzen published. That work is all done based on economic data. It's about how money flows through the system and between sectors. This sort of analysis that Scott did here is different because it really gives you fine-grained detail. So you're able to actually estimate the carbon footprint down to one single blood test. So for example, a full blood count. And you do this by enumerating all the processes that are required to do that, to produce a blood test, and then measuring all of the component materials and all of the energy that's consumed in that process. And that's why it's called, as the other, as economic method is as well, a life cycle assessment, because it looks at all of those processes right back from the raw material extraction to the material processing, to the distribution, to the use, and to the disposal of all of the processes that are involved in doing one blood test. And what we found by doing this work was that the carbon emissions per test are small, and I guess that's not surprising, but the combined impact is big because so many tests are done. We do something around 100 million blood tests that are paid for by Medicare every year. So, you know, it adds up. The other thing that we found was that most of the emissions actually come from the sample collection. So between 60 and 95% come from the sample collection. It's not from the reagents and what's used in the lab. It's all the things that happen before the sample actually gets to the lab. And part of that is because the pathologists have actually done a great job in trying to green laboratory practice already. But what that means, and it's really important, is that the only way to significantly cut the footprint of common blood tests is to do fewer of them. So I'd like to just give you an example. I found this absolutely just jaw-dropping when I found out about this, but did you know that every year there's over 4.5 million vitamin D tests done in Australia? That's one test for every 6 Australians. It's really quite remarkable. That's a 12% increase in 2020 over the average for 2018, 2019. But even more remarkably, testing rates have been rising every year for the last 20 years, except for 2014. Perhaps even more remarkably, 76% of those vitamin D tests on investigation don't meet any of the Medicare indications for doing that test. So, like Rochelle was explaining, they're not actually helping people to do all those tests. But what they do is, because the carbon footprint of one test is somewhere between 0.5 gram and 50 grams, which isn't very much, but when you do that many tests, you find that actually there's between 50 and 200 tons of CO2 emitted every year just from doing vitamin D tests. And that's equivalent to driving somewhere between 300,000 kilometres and 1.2 million kilometres in a standard passenger vehicle. And that's just one test. And you imagine a pathology lab and all the tests that get done. So my solution, Sophie asked us to focus on solutions. My solution is, could we just start by doing fewer vitamin D tests? It's one little thing, but actually it would make a difference. And then perhaps we could generalize that and try to do less tests more broadly. And if we were able to somehow only do the tests that are actually indicated, then we would have a massive impact on the carbon footprint of healthcare. And we're not talking small biggies here. 36,000 kilotons per year and increasing is the carbon footprint of the Australian healthcare system. Another remarkable thing that I discovered is that the footprint of Australian healthcare per capita is bigger than that of England, Canada, Japan, way bigger than China. In fact, almost as big as the US. And so what we find is that we're actually in a vicious cycle, because we know that the health system is causing pollution through carbon emissions, but other types of pollution as well, air pollution. We know that this is exacerbating climate change, and we know that climate change is causing many, many threats to health. And all of those increase demand for healthcare. And so we're actually stuck in a vicious cycle. So I guess my second solution is, could we generalize the concept of doing less vitamin D tests and actually just do a cull of low value care? Rochelle and others have mentioned that about 40% of healthcare, thanks to Jeffrey's great piece of work, thank you, is low value care. It isn't helping patients, it's adding to costs, but it's also significantly contributing to the carbon footprint of healthcare. But it represents an enormous opportunity. If we could just cull that, we could reduce the footprint of healthcare overnight, and nobody's health would suffer by doing that. So that is my plea. Could we just please do that? Because if we don't, well, we've heard many compelling talks about what's going to happen. And that's it from me. I'll leave it there.
Alex, thank you very much. That was short, but a tour de force. That's fantastic. I love the model, and it's scary, but it's very elegant.